Tuberculosis Sanatoriums and Indigenous People in Canada. In the first half of the 20th century, tuberculosis was a big problem on reserves. Children were taken from their homes or residential schools and sent to a sanatorium for experimental treatment if suspected of tuberculosis. The treatments were inhumane and directly led to the deaths of many Aboriginal people instead of healing them. The sanatoriums were also dirty, with many cases of abuse recorded, both physically and emotionally. The government treated Indigenous people as less than human by not giving them the same medical care as Euro-Canadian citizens. The standard practice at the time was to allow the patient to heal at home, surrounded by their friends and family, with therapy in a comfortable, familiar setting. Indigenous people were sent away from their homes to sanatoriums and given experimental therapies without consent or contact with family. Some of these therapies included electroconvulsive shocks, exploratory surgeries, and extreme bed rest for months, all in an unfamiliar and crowded setting. This obvious difference in care demonstrated how the lives of Indigenous people were seen as less than those of the Euro-Canadians, considering the First Nations people were treated similarly to animals and little care was given for their feelings, desires, and well-being, instead using them as cheap research to find better cures for the Euro-Canadian population. Many of these Aboriginal people did not even have tuberculosis. They were seen as bodies to experiment on. Tuberculosis was a problem for all Canadian citizens, but especially the Aboriginal population. This large difference can be attributed to the living conditions of the Aboriginal people. Almost 50% of First Nations live on reserves. Many of the communities are isolated, therefore making fresh food and healthcare significantly more difficult to obtain. Foods such as fruit, vegetables, and milk have to be transported long distances, therefore they are less readily available, which can contribute to the declining health as well as the lack of medical supplies and professionals available. The homes on these reserves are generally poorly ventilated, overcrowded with contaminated water. All of these factors contribute to the high occurrence of tuberculosis on reserves compared to the rest of the population. The federal government has capped funding since 1996 with only 2% increase. This does not count for the population growth, leaving the reserves increasingly underfunded and overcrowded, which in turn continues the cycle by increasing factors that contribute to tuberculosis. The first graph shows the amount of Aboriginal people infected with tuberculosis versus non-Aboriginal Canadian-born citizens infected with tuberculosis. As you can see, Aboriginals have a significantly higher rate, which leads to the belief that their socioeconomic status is one of the major problems contributing to this difference. The second graph shows the amount of homes in need of major repair belonging to Aboriginals versus the rest of the population. As you can see, on reserves, Aboriginal people have approximately 7 times more of the population living in these horrid conditions versus the rest of Canada. This is just a glance of the poor living conditions of the Aboriginal people. The federal government has contributed some money towards repairing reconstruction of houses on reserves in partnership with the Canadian House and Mortgage Corporation, although they state that there is no legal or treaty right to do so. These poor living conditions lead to more cases of tuberculosis, which in turn is costing the government a lot of money and medical expenses. Contributing to the money to improving the living conditions on reserves now will save the government money in the long run, as well as the lives of many Aboriginal people. Little has changed in policies regarding Aboriginal welfare since pre-Confederation, and in that time, Aboriginal people were seen as a problem that needed to be solved since their culture and practices were seen as savage and foreign compared to those of the Europeans. The Canadian government not only put Aboriginals in poverty, but keeps them there due to underfunding of essential services such as housing, clean water, and education. Recently, the media has been highlighting the failure of the government to put policies in place to improve the living conditions of Aboriginals. This led to a meeting between the Crown and Aboriginal leaders in 2012. Though no serious action or changes came out of this meeting, therefore no significant improvements have been seen. The Canadian Tuberculosis Association referred to Indigenous people with tuberculosis as having Indian tuberculosis during the lifespan of the sanatorium, as if it was a separate disease. This contributed to the power imbalance between Canadian citizens and Indigenous people. This increased segregation and isolation of the Indigenous people because Canadians were taught to fear this new disease of Indian tuberculosis, which made Aboriginals appear to be a different species than the rest of the population, less than human, and more like animals. In 2007, the Indian Residential Schools Settlement Agreement awarded $2 billion to victims of the residential school system. The Government of Canada recognized the damages that were done to the victims of the residential schools. Many of the children were enrolled in both residential schools and sanatoriums, although that is not the case for all of the sanatorium patients. If a patient could not prove that they were enrolled at a residential school, they were denied compensation. As the patients of the sanatorium as well endured similar abuse in addition to horrific medical experimentation without consent, they should as well be entitled to compensation for their suffering at the hands of the government. This settlement agreement is a display of Canada taking responsibility for their actions and the effect that it has on the people who suffered. But is this enough? Indigenous people are still in a state of poverty and isolation from the rest of the Canadian population. Further action needs to be taken in the future to not only pay back the victims of the residential schools, but as well the victims of sanatoriums and cultural genocide as a whole. The Charter of Rights and Freedoms was signed in 1982, but the sanatoriums predated this document at their peak in the 1950s. If the Charter would have been in place, many of the human rights of the Indigenous people would have been violated. Section 7 of the Charter of Rights and Freedoms applies to everyone, Canadian and non-Canadian citizen. Section 7 includes the right to life, liberty, and security of the person. Life. Aboriginal people had their life put on the line during experimental treatments where many of them were killed as a side effect. Liberty. Aboriginal people had their right to make personal decisions taken away when they were forced into sanatoriums and experimented on without consent. Security of the person. Aboriginal people had the right of their own bodies and its health ripped away from them. Therefore, Section 7 of the Charter was violated on all three terms. It is legal under the Indian Act to apprehend Indigenous people suspected of having tuberculosis and put them in a sanatorium. This remains a part of the Indian Act today. This is a blatant disregard for several laws within the Charter of Rights and Freedoms, such as Sections 7 and 8. This should be removed from the Indian Act as it is unconstitutional as stated previously. In conclusion, Indigenous people were taken from their homes and subjected to inhumane experimental tuberculosis medical testing. Their lives were seen as less than those of Euro-Canadian citizens as evidenced by the difference in care. The living conditions on reserves have contributed to the increased rates of tuberculosis, and not enough has been done by the federal government to improve these conditions. The Indian Residential Schools Settlement Agreement was a start to make amends, but the charter rights of the Aboriginal people were violated. Therefore, more effort should be put into repaying those that were affected by the horrors of the sanatorium.